So hi everyone and welcome to our discussion. I'm Rachel, one of the research assistants for the Rights for Children and Youth Partnership team in Canada. Rights for Children and Youth Partnership is an interdisciplinary collaboration between researchers from universities and governmental, non-governmental, and international organizations. This project has been developed to increase knowledge of factors which support or hinder the protection of youth and children rights in the Caribbean, Central America, as well as diaspora populations in Canada. Today, I have here with us Danielle and Liz. If you both can please introduce yourselves.
Oh, hi. My name is Liz Okai, and I co-manage the day-to-day operations of the Child Welfare Immigration Center of Excellence, or CWICE for short, which is operated by Peel Children's Aid Society, or PLCAS. I have worked in child welfare for over 15 years and have been a leader in the field, specializing on the intersection of child welfare and immigration for the last 11 years. My work in this area for several years contributed to the development of CWICE, which officially launched in June 2018. And I have continued to lead changes in the sector since then. I am passionate about this line of work, and I continue to systematically build our sector's understanding of the intersection of child welfare and unresolved immigration status, settlement, and border-related issues. As an avid advocate for the children, youth, and families that we serve, I see building strong partnerships with different levels of government and community agencies as being pivotal to the work that we do.
Thank you, Liz. I was wondering if we could hear about Danielle.
Thanks, Rachel and Liz. So a little bit about me and my career. I've had the privilege to work across industries and fields of social work practice with very different stakeholders. I practice from a strong belief in leadership, equity, excellence, and learning. And within CWICE, as Liz mentioned, I co-manage the program with her. And I think probably together, it's fair to say we're immensely proud of the program, and I'm immensely proud of the program that we've developed together over the last 3 years. In CWICE, I oversee the research and training portfolios, provincial and national strategy, and my team is supporting child welfare staff across the province.
So thank you, Liz and Danielle, for telling me more about your work and for your passion about working with CWICE. And speaking of CWICE, I was wondering if you could tell me more about what the program is about.
Okay, so CWICE is an Ontario-wide service and training center that is recognized nationally for its leadership and innovation. As Danielle said, she's really passionate about leadership. We offer a range of services in Ontario, including responding to child protection concerns with an immigration context, including at Canada's largest airport, Pearson. We have a centralized consultation center that offers support and advice to child welfare workers across the province when they are managing complex child protection cases involving immigration. We assist children facing challenges related to immigration status and provide support with the immigration and refugee process. We also provide referrals to resources in the community to support families caring for children without status. Ultimately, our goal is to create pathways to permanency for children, youth, and families. We promote equitable outcomes, so clients receiving service anywhere in the province have access to similar approaches, resources, and staff are informed and can support clients with their rights. We promote early and proactive child welfare practices grounded in anti-racism and anti-oppression to remove barriers our clients face in terms of unresolved immigration, settlement, and border-related issues.
Mm-hmm. It sounds like there's a lot of positive and important implications of what you do at CWICE.
Yes, thank you.
So I was curious about why is there a need for research related to the intersections of immigration and child protection?
I think maybe I can speak a little bit to that. We really see our role as being building awareness of the intersection of child welfare with unresolved immigration needs or unresolved settlement needs, or children who are within the child welfare system who are experiencing a border related issue, which could be a placement needing to live across borders or move across borders. And really, our role in the province of Ontario is to build that awareness within our sector. And so one of the ways that we've looked at doing that is trying to build a training program, an 8-part certificate for child welfare workers to learn more about this intersection of the two systems. I think it's been important for us to partner with academic institutions who have an interest in immigration, because I think there's probably little to no research on structural or systemic approaches like our program. This program that we operate is designed to support child welfare staff who are working with refugee and immigrant clients. It's really the first of its kind program in Canada. And so it really fills a service need, but I suspect a system and systemic approach need as well that should be documented in the literature. And I think we know from our data, we know from our service related data that there's a variety of needs that people are experiencing. And so we have to continuously build that awareness in our sector of what are the trends or the issues. And particularly during COVID, it's been very important for us to communicate as widely and as often as possible, because things have changed and circumstances have changed so drastically during this time. So public newsletters or reporting or conversations and training opportunities, it's really important for us to share that knowledge. But as we build that knowledge, I think it's also important for us to document that. And so this idea of even the needs of children across borders is not well documented from a child welfare point of view or a child protection. So what happens when a child is abroad and unsafe and needs to be repatriated back to Canada? That child needs to go across maybe one or more international borders. And what is that journey like, and what's that experience like? Mm-hmm. We know that in our work, we can't ignore immigration status when we're delivering child welfare service. We know if we ignore this part of someone's identity, that we may have negative outcomes in service. So we may find that children or youth have a lack of access to services in education or employment or health services. And in some cases, some youth or children may face deportation, or young adults. And so we know that our system is complex. We know that the immigration system is complex. And if you're navigating both, system navigation is extremely important. And that part of the mapping process, the institutional ethnography project, the rights for that we're working on in partnership with the Rights for Children and Youth with Ryerson, is such an important aspect of that system navigation and documenting and identifying that. We also know that right now in Canada, 1 in 5 people were born in another country. And so it's important for us in child welfare, as we work with the diverse clientele and as we continue to work with families and children that are within our communities across Canada, it's important that we identify in assessments and in service planning what their immigration status and needs may be. And if those are unresolved, and how do we support and provide access to services? So the gaps in the research from our perspective are really that there's a lack of identifying the point of view of children. So when we work with children, it's very important for us to elevate their voices, their experiences, to adult attention, to system attention. So elevating those voices, those experiences in the literature and in the research is really important. And particularly identifying the voices of children surrounding issues where child welfare, child protection, and immigration intersects, and maybe when there's there's a question around best interests of children. I think that would be an important gap to fill. I think we're also very inspired by the partnerships that we have selected with some academic institutions that will help us to try and bridge these research gaps in the upcoming, the near future. And so I think that will ultimately serve the clients that we are currently serving and the ones that come to our attention in the future. I think that will help us all serve them much, much better. So I think we're looking forward to the future.
Thank you so much, Danielle, for telling us about the gaps currently in the literature that is missing when looking at the intersections of immigration and child protection and the potential of what our partnership and your research can do to mend that gap. Liz, I was wondering if you could speak more about the need for the CWICE Center.
Yeah. Yes. So as I listened to Danielle, she talked about a lot of the gaps that, our service CWICE fills. And so she answered most of that in her, just even talking about the research. But I just wanted to turn our minds to the fact that the center is really here to fill a gap. Because historically, child welfare in general, Ontario nationally has not turned its attention or mind to the negative impact that unresolved immigration status or even settlement issues can have on the functioning and well-being of children, youth, and families. And so, for example, if you go, when we have clients refer to us and you go out as a child welfare or child protection worker or professional, and you do your assessment and leave out immigration pieces and really the family struggling, you would realize that you wouldn't have to address something like physical abuse or something like that and leave the family that is, having challenges due to their status and leave that untouched or unaddressed. You haven't really done much. This is what we've seen in the work that we do. And so how I like to answer this particular question is to turn it around and say, if CWICE wasn't here, if you look at all that we have done so far in our 3 years of being here, if CWICE wasn't here, what would happen? What would the challenges be for the children, youth, and families that we have served, we have helped? So I can tell you that many children that have received citizenship through us would not have their citizenship. Children who have received their obtained PR status or permanent residence status, families, entire families, children would not have done that, would not have been able to do that. And with that, what happens is the greatest thing that happens with status, or once status is resolved, is that they are able to have access to things like healthcare that we take for granted as Canadians, right? We have our health card, Ontarians, and we just go to the hospital or go to a doctor when we're ill. Our children, families that come to our attention with unresolved immigration status are not able to do that. So a child could have a toothache for months and months, and the parents are not able to do anything about it. They are also the lack of access to education, especially post secondary education. Once they have status, they don't have to have that challenge. So many things, just things like financial supports, community financial supports that people can turn to when they fall on hard times. The families that we see with unresolved status are not able to do that. So there are so many barriers that these families face. And so in child welfare, I think that we should be looking at cases holistically, and that when we go into a home or a family becomes involved with us, that we're looking to really help them, at least place them on a path to permanency regarding the immigration. And if they're newcomers and they do have their status, then we're helping them navigate the system, which these we call settlement and integration issues. So CWICE is here to really fill this big gap that is here. And we see that in the number of referrals that we have and how we're helping. We see that is really working.
Thank you so much for speaking about our system has unmet needs facing families and children who are seeking status here in Canada and the barriers they currently face. And it sounds like the CWICE Center has really worked hard to fix that huge gap that needs attention now. So for our last question, I was wondering if you have any advice for current or prospective child protection workers working with children navigating the immigration system.
Yeah, thank you. I believe that the advice, first of all, and I think I spoke to that, and Danielle has also spoken to that in our previous, responses. The advice is really to take a holistic look at a case and include immigration status or even settlement and integration issues. And so the advice is not just for workers, but it's for our agencies, because workers will have to get the permission, right, to be able to do this work properly. They have to get the buy-in from the agencies. So really the leadership and child welfare agencies should turn their minds to the fact that immigration status, unresolved immigration status, and settlement and integration issues really impact a family's life. They have negative impact on a family's life. And so it should become part of the assessment, first of all. And also the advice is right at the front door that those questions are being asked, that we are really completing our identity-based data, because immigration is part of identity. And once you know a person's identity or a family's identity, you are able to service them more appropriately and to direct them to the right resources. And so the advice really is to have a holistic assessment, including immigration status and settlement issues. Thank you.
No, thank you for speaking to that. That's some great advice to give. So thank you, Liz and Danielle. We really appreciate your time and enthusiasm in your work and for this partnership. So that concludes our discussion today. But if listeners want to learn more about CWICE, please visit www.plcas.org/CWICE. Thank you again to everyone. Take care.
Thank you, Rachel. Thanks, Liz.
Thank you.
Bye-bye.